So what do we know about diagnosing dyslexia? Why would we? What would we do? And how would we do it? Diagnosis of dyslexia is the essential first step in bringing relief, understanding, increased self-esteem, and a positive future to a child. A diagnosis is akin to finding the key to unlock a mystery. It puts the pieces together, explains so many puzzling aspects or seeming contradictions often noted in a child, and gives a direction. Once a parent or educator knows the diagnosis, they will know what they can do to make the most positive difference. A diagnosis is specific and definitive, reflecting a synthesis of the best scientific knowledge and observations and evaluations of a child. When the pieces of what were previously a confusing puzzle are synthesized into a coherent whole, a diagnosis of dyslexia, the response and relief are palpable. The diagnosis allows the child to know she is not alone, that she is a member of a community of boys and girls who are dyslexic. Right before a patient of mine, Joe, popped the question to his girlfriend, Emma, he looked her directly in the eye, cleared his throat, and said, "Before we go any further, there is something about me you should know." "Oh, what's that?" asked Emma. "I'm dyslexic," Joe said. "Oh," laughed his fiancée-to-be, "don't worry about that. I'm dyslexic too." A diagnosis also brings together the various adults who interact and make ongoing decisions impacting the child's daily life and her future. Having the symptoms coalesce into a meaningful diagnosis that has a name and explanatory power also provides a common language that facilitates communication with specialists in disparate disciplines who have an impact on the life of a child who is dyslexic. There are some very common misunderstandings that require clarification, and this is very important. Why dyslexia and not just call it a learning disability? Beware of such innocuous sounding but essentially uninformative and unhelpful terms as learning differences and learning disability. A dyslexic individual learns little from this kind of label. Self-awareness is certainly not strengthened by these terms, which are vague and lack specificity. Dyslexics have a reading impairment, not a thinking impairment. This is one reason why it is important to differentiate dyslexia from the general and more heterogeneous term learning disabilities. When I testified before the House Committee on Science, Space, and Technology on the science of dyslexia, I addressed the distinction between dyslexia and learning disabilities. Dyslexia is specific. Learning disabilities are general. Dyslexia differs markedly from all other learning disabilities. Dyslexia is very specific and scientifically validated. We know its prevalence, cognitive and neurobiological origins, symptoms, and effective evidence-based interventions. Learning disabilities is a general term referring to a range of difficulties which have not yet been delineated or scientifically validated. Learning disabilities are comparable to what in medicine are referred to as infectious diseases. That is, learning disabilities are more like the general term infection, which can have many different causes, along with many different symptoms and differing treatments depending on the specific infection. While dyslexia is akin to being diagnosed with a strep throat, a highly specific disorder in which the causative agent and evidence-based treatment are both known and validated. How unlocking the origin of the problem brings clarity to what dyslexia is and how it impacts a person. A major reason a diagnosis of dyslexia is able to pull together and make sense of what may at first blush appear to be a random array of symptoms is that science has uncovered the origin of the difficulty. As I said, the basic deficit in dyslexia is a problem in getting to the individual sounds of spoken words. This scientific knowledge allows the clinician, educator, and especially concerned parents to recognize the symptoms of dyslexia, to know in a tangible way the why, what, and how of dyslexia. This allows a reliable diagnosis at the earliest possible moment. And here, in this figure, getting to the sounds of spoken words. This is so important because it tells you what the basic difficulty in dyslexia is. As shown in this figure, if you have difficulties getting to the individual sounds of spoken language, you will likely have problems with, starting with spoken language itself, both delayed language early on and word retrieval difficulties later on. And by word retrieval, in a dyslexic person, that person up in their brain knows what they want to say, but they have to access and retrieve the right phonemes, and they often don't. So what comes out of their mouth doesn't match what they intended to say. Have difficulties attaching letters in a word to the sounds they represent, decoding or reading difficulties impacting both accuracy and fluency, encoding difficulties, that is, transforming here sounds into letters, impacting spelling. And finally, learning the sound system of a foreign language. Imagine you've had trouble learning the sound system of your primary language, and then you're asked to learn that of a secondary language. First, we'll begin with Dr. Cassidy. Could you introduce yourself and Mr. Lenz, who is here with you?
Yes, I'm Laura Cassidy, Dr. Laura Cassidy, as Sally said. I am by profession a medical doctor, and personally, I am the parent of a dyslexic. And on the volunteer side, I am the co-founder of Louisiana Key Academy and the present and the only so far board chair of Louisiana Key Academy. And Stephen Lentz.
Hey, yeah, I'm Stephen Lenz. I am a parent of two children at Louisiana Key Academy, two dyslexic children. And I worked as a teacher, an elementary school teacher for 9 years prior to becoming an attorney. And I'm an attorney here in Louisiana, in Baton Rouge.
Everyone agrees how important it is for dyslexia to be identified early. So why do you think there isn't early screening?
Well, personally, I think there's two main reasons. One, I think, and this is maybe sounds esoteric, but I think it's important for people to understand, because at the federal level, under IDEA, special ed, although dyslexia is the most common entity, they don't have their own category. It is buried under 60-year-old language under SLD, specific learning disability, which isn't specific at all. But I think that sort of obfuscates, hides dyslexia. And then the second thing is under No Child Left Behind, the response to intervention, or the MTSS model, it just tells, it basically has the schools take struggling readers and put them in, a pullout for 30 minutes, 2 or 3 times a week, never identified as dyslexia. So because dyslexia is really hidden at the school level, not talked about, not encouraged, I mean, why would they screen? If you know, it's sort of like you don't screen for something unless you really think it's valid and you see the incredible consequences of not screening. And so far, in my opinion, they must not believe in the consequences or else they would be screening.